This eerie, foreboding structure, also known as Ravenscrag, became a house of psychological horrors, all under the watchful eye of one of the world's leading physicians, Dr. Ewan Cameron.
The story of Dr. Ewan Cameron is one of the most tragic, but one of the most clearly visible stories of what happened during the mind control experimentation days.
Using unknowing Canadian citizens as test subjects, Cameron had developed a new procedure which caught the eye of the MKUltra researchers, as well as the Canadian intelligence community. He was hired by the CIA and the Canadian government to further explore the treatment, which he called psychic driving.
First, Cameron proposed that they would use intensive electroshock and LSD and other disorienting drugs to, in his terms, de-pattern individuals, basically to wipe the slate clean. Second, using tape-recorded messages, try to program in new behaviors by repeating these messages hundreds of thousands of times, while the victim was immobilized with other drugs. And the final phase was to try to wipe the slate clean so that people could not, again, remember what had happened to them, but still have the new behavior.
The psychic driving experiments literally reduced the person to a vegetable. One of the group of people was a man called Robert Logie, who lives in Vancouver. He was also a victim of these psychic driving experiments where tape loops were played countless hours per day, many months in a row.
I heard 4 words, and it's very hard for me to say. 4 words I remember where you killed your mother.
None of this, of course, was therapeutic. None of it was warranted by the conditions under which the people had gone to the institute. None of it was done with consent, and none of it was done with the awareness of the people that they were experimental guinea pigs in an advanced brainwashing experiment.
Another of Cameron's patients who endured months of mental torture was Linda MacDonald.
I think there were about 80 of us. We discovered that these 80 people were just ordinary, everyday people. It could have been you, it could have been me, it was me. It could have been anybody who just walked through the doors of the Allen Memorial on the wrong day at the wrong time when Dr. Cameron needed another schizophrenic for his fun little stuff upstairs.
Linda MacDonald started off as a pretty much normal person. She basically came into the hospital as a mother with many young children who was a little overwhelmed and depressed for just routine psychiatric treatment.
And 3 weeks after I was there, I was shipped up to the sleep ward. And I came out of there a vegetable 5 months later.
By the time someone was in the sleep room, the ability of that individual to remember or describe what happened to them was very limited. So the descriptions that there are from nurses and from other people who worked at the facility, and their descriptions are, to quote one, like something out of Dante's Inferno.
Within the walls of this living hell, patients would be subjected to electroshock therapy that went well beyond the professionally accepted guidelines of 4 to 8 treatments.
I received a total of 109 electroconvulsive shock treatments. In less than 5 weeks, I had 86 straight comatose days where I was completely out of it. The purpose for all of this was to wipe my memory, to take a life, to wipe it completely clean. So I would not have a memory ever. When I came out of the treatment and they had decided that my memory was wiped sufficiently, I didn't know who I was. I was a baby. They had to toilet train me, and they had to teach me to walk and talk and feed myself.
She has absolutely zero direct memory of her life before age 25. Now, it doesn't take long to figure out why the CIA or other intelligence agencies would be interested in such research.
Well, if Cameron can get it to work for a psychiatric patient, well, then they can use the same thing to deprogram somebody and put them back together for a brainwashing scenario.
It would not be until years later, after an emotional divorce from her husband and the painful loss of custody of her children, that Linda MacDonald would learn of the hidden purpose behind the treatment she had received.
This big headline saying, Dr. Cameron, CIA brainwashing experiments, and I stopped breathing for a minute. You could have knocked me over. I knew Dr. Cameron was my doctor. I knew I had been at the Allen Memorial. But up until that moment, I believed, because that's what I was told, that the doctor had fixed me, had done to me great things, and I was lucky that he had been my doctor. So I couldn't not read the article, and as I read it, I was just horrified.
My participation in it was in terms of trying to evaluate the behavior that was described. I don't think I can add anything that that hasn't already been. Frankly, it's an area I don't like to talk about. It's not that but I don't like to talk about it.
This is the Allen Memorial Institute in Montreal, one of Canada's most highly respected psychiatric hospitals. In 1956, the director of psychiatry here was Dr. Ewan Cameron, one of the country's most highly regarded psychiatrists. Patients were referred to him by doctors from all over the world. Dr. Cameron was doing research of his own in the field of brainwashing. He was fascinated by the mind control he had heard described in countries behind the Iron Curtain. The CIA was fascinated too. The court case alleged that the CIA backed Dr. Cameron's horrific experiments that were conducted on more than 70 patients, forcing them to endure 3 tormenting phases of so-called treatment. First, according to the complaint, Dr. Cameron and others would give patients mind-altering drugs like LSD and angel dust. They would mask them and force them to inhale laughing gas. They would give them high-voltage electric shocks several times a day, effectively turning the patients into vegetables. Once the patients were immobilized, Dr. Cameron would play what were called psychic driving tapes, messages that were repeated up to 500,000 times. Finally, Dr. Cameron would put the patients to sleep with massive amounts of barbiturates. These sleep episodes could last 50 days or longer.
They took me in a room outside the ward, in a very little room, and they put 3 or 4 pillows at the end of the bed, and there were 4 doctors at the end of the bed there, and one doctor was putting me a mask there. The doctor started from left to right there, telling me, kill him, 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 kill him. What did they want to make me kill? I'll never know. They never told me. I don't know.
By the early 1970s, word of the CIA's mind control atrocities began to leak out to the public. An investigation was launched, resulting in the creation of 1 presidential commission and 2 Senate committees.
And my feeling now is that the CIA had overall powers that put them in a different situation than other people.
The American public was in shock.
I am terribly upset that the system is such that what happened could happen.
Their search for answers, however, would soon hit a dead end, as investigators learned that Dr. Sidney Gottlieb had destroyed the majority of the documents relating to the MKUltra program. It was now impossible for the American public to discover the truth about what the CIA learned from its mind control research.
If Sirhan murdered Robert Kennedy to make a political gesture on behalf of the dispossessed Palestinian Arabs, why doesn't he remember? And why such remorse? My own conscience doesn't agree with what I did, Sirhan says sadly. In what way? Pollock asks, taken aback. It's against my upbringing, says Sirhan. My childhood, family, church, prayers, the Bible and all this, sir. Sirhan, as many people don't know, was a Christian. Now returning to the quote. And here I go and splatter this guy's brains. It's just not me. It's just not me.
My own conscience doesn't agree with me with what I did.
Your own conscience?
My own conscience doesn't agree.
In what way?
It's against my upbringing, my very nature, sir. My childhood, my family, the church, the prayers, the Bible, all this, thou shalt not kill him. And here I go and splatter this guy's brains. It's just not me.
If we accept for the moment the possibility that Sirhan was a remote control assassin, The question then arises as to who could have programmed him. Suspicion has fallen in recent years on a small group of West Coast doctors who were active in secret CIA mind control experiments. The most flamboyant of these was the late Dr. William Bryan. Again, Dr. Philip Melanson.
William Bryan was, by his own admission, one of the primary researchers for the government in brainwashing, in hypnoprogramming, and in a variety of things. He was an out-of-control, super hypno character who exploited women through his hypnosis practice and was temporarily disbarred as a result. He bragged about his work for the government, said he was the czar of brainwashing, and he was also involved with the man I call Reasoner and with another man, all of whom worked together in Southern and Northern California, all of whom worked for the government, and my belief is that two of them, if not three of them, had something to do with Sirhan's programming.
William Bryan was a rather large man weighing 386 pounds. He has been variously referred to as the most brilliant man in the field of hypnotism and as a, quote, misguided genius. His private practice involved sex therapy, and by his own admission, he frequently had sex with his female patients. Did William Bryan believe that a subject could be programmed to perform acts that were out of character? Let's listen.
You have to have the person locked up physically, and there is also the use of long-term hypnotic suggestion, probably drugs, whatever, and so on. Under these situations where you have all this going for you, yes, you can brainwash a person to do just about anything.
Did William Bryan have anything at all to do with Robert Kennedy's accused killer? Well, in the year before his death in 1976, Bryan reportedly bragged to two prostitutes who serviced him regularly that he had, in fact, hypnotized Sirhan. Bryan also liked to brag about his most crowning achievement, the deprogramming of Albert DeSalvo, the Boston Strangler. In Sirhan's notebook, that strange document with page after page of almost indecipherable trance-induced scribbling, there appears the entry, "God help me, please help me. Salvo, di DeSalvo, die salvo." It's a curious notation to be sure, but is it possible that while working upon Sirhan, the programmer couldn't help talking about his favorite subject? And that this entry, by way of the captured mind of Sirhan, is really the palm print of Dr. William Bryan? If we take Sirhan's words, "It's just not me," at face value, then who was it? What bad dream befell this young man?
It's my handwriting. They are my thoughts, but I don't remember them. They are the writings of a maniac. They're not the writings of me now.
Well, Jim had armed guards. I mean, young men and women who were told that they needed to watch everybody, and it kept you working hard. We headed out to the fields, and you vied to go really far out, actually, because you couldn't hear Jim over the loudspeakers.
Jonestown was wired with loudspeakers, and Jim spoke 24 hours a day on it. When he wasn't speaking, the tapes that they'd made of him speaking played on and on and on.
A man named Dwyer was the head of the CIA here. I mean, the CIA had a presence here. It was an unrevealed presence at the time.
I had a premonition about the trip. There was something that just made me feel a great deal of uncertainty.
In 1978, Jackie Spear was the legal aid to San Francisco area Congressman Leo Ryan. They were about to embark on a fact-finding trip to look into reports of abuse and brainwashing at the remote jungle compound known as Jonestown.
I always kind of shake my head in disbelief when they refer to it as a suicide. Those people were not in control of their minds. They had been brainwashed.
It's my impression at this time that they were conducting some sort of mind control experiments. For example, they had a very modern hospital down there which they bragged about. So modern that in that population they had medical checkups for everyone every day. So there's no need for that unless you're conducting experiments where you're having control groups and you're giving people, and they're giving their vitamins every day. And it's my guess that they were just using them as guinea pigs to see what they could do under isolated circumstances. They take them off into a jungle someplace far away from everybody. They get them there somehow, and then they're able to see how these various drugs work on different groups.